Welcome back to the Healthy Commute. I'm Dr. Dan with Dr. Pascal, like always. So today we're going to talk about does the name of your pain really matter? And the reason why we wanted to address this today is that the last few podcasts we talked about lower back pain in terms of causes and symptoms, and then we also went over exercises that, depending on the type of pain that you're having in the lower part of the back, you could do to help kind of ease the pain. But still the question comes up, time and time again with our patients. And that basically is that they come in, let's say, for, there's a specific concern that they have. And we go over, let's say, what we found, we go over the causes of things and kind of a plan to kind of get things back on track. But I think because we're so ingrained, in our society of, going to see the doctor and getting a specific diagnosis for something, and we want to put a name to the symptom that we're having. And what we want to kind of address, number one, is that's exactly what it is. It's the name of a symptom and not the cause that we're kind of focused on. And that's what we really want to maybe kind of uncover today is, what is causing the issues? And that's our main concern.
And I think where this is also stemming from is we have a lot of patients who want their pain to go away as fast as possible, right?
Of course.
All the time.
Me too.
Exactly, of course. No one likes to live in pain. The reality is pain is a really tricky thing, especially low back pain. As we've discussed on these previous podcasts, it's very widespread. People can suffer from it. A lot of people can suffer from it, 80% of adults, and it can stick around for a long time.
Yeah.
And I think when someone starts going through a treatment program and doing things to get the spine to become better, and that pain still lingers or it kind of flares back up, they come back and they say, Doc, well, what's wrong? What's really causing my pain? And we kind of forget, or they want to know, is there a diagnosis or is there something that we're missing because the pain is still there, right? And so the brain starts thinking, well, maybe if I find exactly what's causing my pain, there might be that magic treatment that'll take my pain away.
Right.
And I think that's the hard part, is to let go of that idea that some magic treatment, because you have a specific diagnosis, is going to nullify or take that pain away.
Right. And probably the best example that we see probably a lot is a famous name called bursitis.
Yeah, exactly.
So we have, let's say, patients that come in and they say, Doc, it hurts right here, it hurts in the hip, it hurts in the lower back, it hurts in my knee, it hurts in this. Then they say, oh yeah, by the way, yesterday I went to see my doctor and my doctor said that it was bursitis. And for us, when we're looking at your body in terms of what's, the normal position, the normal function of the body, really the name bursitis, and when you see or you hear itis at the end of a word, all it means is inflammation.
Yeah.
So bursitis means inflammation of a bursa or a joint.
Yeah.
So now the fancy word was you got diagnosed with inflammation of a joint. Great. What does that do? You still have a problem, you still have pain. What we want to figure out is, why is there inflammation in your joint? Why is there unnatural pressure? And what can we do to take that pressure off so your body could function as close to a normal position or normal function as possible?
Yeah. And so if we just take a step back, and of course, sometimes in cases of back pain, there can be very serious things that are wrong, right?
Yes.
Such as, an abdominal aneurysm, or there's a tumor growing inside somebody. And these are like these cases of things that could cause back pain. And of course, we're aware to these things. They are very, very rare. And when those cases arise, the diagnosis is important, ship you off to the hospital. Those are emergent situations where that needs to get treated.
Without a doubt.
But the majority of back pain is due to the spine, right? Spinal conditions and associated muscles. And so whether the joints in the spine are jammed up causing pain, or whether the muscles are starting to spasm, or whether the disc has been bulged, herniated, aggravated, all of these are a result of, not the cause of, right? They are the result of bad positioning, stress to the spine, lack of movement in the spine that build up over time and cause you to have back pain, right? Mm-hmm. So we're not treating the tight muscle, we're not treating the injured disc, we're treating the spine that's in bad shape. And as we get the spine to become healthier, those conditions can improve and can heal with time, and then generally function better in the long run, right? And that's kind of the approach that we're taking for us, is to fix the condition that caused the problem in the first place. We're not chasing the pain of, well, what are we going to do for this disc herniation?
Right.
Does that make
Yeah,
sense?
without a doubt. And I guess maybe I'm just thinking of an analogy. It's kind of like, we've had our first home had cracks in the foundation everywhere.
Yeah.
So, those sometimes brings back a little bit of nightmares, but it's kind of like if I had a contractor come to my house and, examine, I'm like, well, there's water pooling in the basement. We have this, there's cracks, we're all these symptoms that are showing up. And it's kind of like a contractor coming in, seeing what, is happening and saying, oh, I know what's your problem. You have crackitis and wateritis, on the floor,
Yeah.
and then turns away and walks away.
Yeah.
And then I'm like, okay, well, now what? What do I do? Like, I can't, there's no magic pill that I could take. There's no magic exercise I could take. What we would have to do is get a contractor that would still understand what's causing that crack in the first place.
Right.
Is it uneven foundation? Has the foundation dipped? So now let's correct that cause. And then after the cause is corrected, then the cracks aren't there anymore. The water doesn't pool up in the basement and so on and so forth. And now all those symptoms are now gone.
Right.
That's what we're looking to do. We're looking to address the reason why there's pressure or stress or pain in the first place.
Absolutely. And some of the common ones that we often hear is, because someone will hurt their back, for instance, and they'll find out where, maybe a physical therapist might tell them it's a disc injury, and another chiropractor might tell them that, it's a lumbar subluxation. The medical doctor might say it's a disc herniation. And so you might get multiple diagnoses for people, and all of a sudden there's a lot of confusion.
That's exactly right. And we could definitely understand that. Is like, who's right? What should I do? I'm even more confused than ever in terms of what's going on. But maybe one thing to understand is we may all be approaching the problem a little bit differently, right? Whereas one person may be I'm trying to just take as much pain away as possible. I'll call it something, and then, whether it's medication, whether it's stretches, whatever it is, to take the pain away. Whereas what we'd like to do is, obviously, like I mentioned before, we want to understand what's causing it to be there first.
Absolutely. And sometimes, like, a very common situation is for when someone has, and let's just take a disc injury, for example. A disc injury is soft tissue of the spine, and if someone, whatever age that is, if they end up with a disc herniation, the pain from that disc herniation can last weeks to months to potentially even a couple of years, right? Mm-hmm. And so oftentimes people, I think, get impatient when the pain doesn't disappear. It's right, like, okay, it's been 3 weeks and the pain is still there. Yes, I completely understand. The reality is this could take up into a year and a half for the pain to totally go away because of that disc injury. And a lot of times people think, well, should I go get an MRI? I understand where you're coming from. The MRI will sort of give you that security that, yes, it is a disc injury, but the big thing is that it does not change the course of action, right? For us healthcare practitioners, whether a physical therapist or a chiropractor, we're not going to change necessarily what we're doing because it's a disc injury, right? We're still going to treat the spine and treat the muscles surrounding the spine the same way to help the person function better and get back to 100%, whether or not that MRI confirms that you have a disc tear. And so a lot of times it's expensive tests, it's jumping through hoops and doing all this stuff to confirm what we already know based on how you're presenting and how you're moving and how you're functioning, right?
That things aren't well. Something is not
100%.
Sitting well, moving well, functioning well, and then that's now causing a symptom.
Yep.
And again, we talked about this on another podcast, but really, what is a symptom? Right? A symptom is a warning signal from your body letting you know that something isn't functioning or working properly. Just like the engine light in your car saying something, there's either too much of something, not enough of something, it's not moving enough, it's moving too much, something isn't right, and I'm letting you know so that now you could either do something different or spend the time needed to fix the cause of why it's there in the first place.
Absolutely.
Do we need more movement, less movement, like more flexibility, more something stuck, we fell, something that happened 20 years ago is now, producing all this pressure because it's just been breaking down over time.
Absolutely. And like you said, Dr. Dan, a lot of times, like when someone comes with that diagnosis and they'll say, oh, I went and got the MRI and there's a disc herniation, right? And it's like it's this revelation for people that there's that disc injury there. But really for us, we go, great, we know it's there, we assumed it was there anyways, let's keep going on the same path to fix the problem so that you can continue to heal. Because if we don't do what we're doing and we leave the spine in the bad shape or in bad shape, that disc herniation with time could lead down the road to
Bigger problems.
or bigger problems,
Yep.
or surgery, right?
Yep.
Most people don't need surgery when they have these problems. We can do the right things early on and consistently do them through life to prevent that problem. But someone that has that disc herniation, if you choose to do nothing now, the pain will go away eventually, but did the problem that's causing that back pain, did it go away just because the pain disappeared? No. And so with time, if we leave it there, that problem will just come back, and later on down the road, it's going to be more costly, and it's going to cost you more time too to try and fix that problem.
So what, I guess, could we leave our listeners with in terms of, what would lead their bodies to kind of signal, symptoms or pain or a disc problem? Like what would cause a disc injury, let's say, in the first place?
So a disc injury is generally, there's two situations where people hurt a disc. The one is someone performing a lift, an athletic endeavor. They feel a pop. There's not a sign of back pain before that, and all of a sudden they go, yeah, I tried to lift this weight, or I'm playing volleyball and I jumped as hard as I could and there was a pop in my back and people had to carry me off the court, right? The other one is the mom or the dad at home saying, I was just going to bend over to pick up a pencil on the floor and all of a sudden I couldn't stand up afterwards. Well, bending over to pick up that pencil on the floor is not enough to cause a disc injury. Even though the disc was injured, it was a buildup of all these other life stresses. Right? So it can be a sudden, abrupt accident that can, yes, absolutely overload the spine and hurt a disc, or it could be the very common pressures that we see in today's society building up over time, where bending over to pick up a pencil is the straw that breaks the camel's back, and then, pow, you have a low back injury that could be a disc, or it could just be general, what they call non-specific mechanical low back pain, meaning your spine has had enough and is not functioning properly, warning sign to your brain, you now have pain.
Yes. Now, the other thing I'm just thinking of as you're talking is, so what can people do, over their lifetime or as a goal to prevent pressures or pain as much as possible? I'm 45 years old.
Yeah.
I'm seeing, more and more of my peers, dropping like flies, meaning that they're physically now becoming more and more unflexible.
Yeah.
They're joking that they're older and older and can't move and can't do this and can't do that. Yeah. And that to me is a little sad to hear them talk like that, because there's so much that people could do, but a big part of it is prevention and keeping their bodies functioning, healing as best as possible. So what could they do as a whole?
So at home, there's a number of things that someone could go down, right? Like we could start talking about nutritional aspects and different exercise programs, but I think you said it yourself. You said the word flexibility, and I think specifically in there, keeping mobility and flexibility, being able to move throughout all of your natural ranges of motion and maintaining that as long as you can throughout life will ward off so many overuse type injuries, like bending over to pick up that pencil and hurting your back, right? Now that's assuming that there's no underlying alignment issue with the spine. But in general, if we want simple things that people can do at home, it's stretch and do some mobility.
And part of flexibility too is that if we're not moving, then the body just stiffens up. So if we're sitting all day for 8 hours, if we're stuck in one position, if we do always the same kind of work or type of workout, or always the same thing, our bodies just stiffen up as we age. And so we need to keep our flexibility and keep our posture and all these things to keep proper alignment so that we could function, heal, and feel good, right? As long as we possibly can.
And so, just getting the spine moving properly, or the whole body moving properly, but part of that to prevent, when we're talking about these back injuries, is continuously moving the spine, right? Throughout different ranges of motions and stretches and staying active, right? So just even playing light sports or going for walks, the more your body moves, the less likely you are to get injured over time. Right.
Now, a shameless plug for Erica. We do she does a flexibility and mobility class here at the office on Tuesday nights at 5:30. And for that really being the goal is just to help people understand what they can do and how they can improve over time and keeping their flexibility, as best as it possibly can.
Absolutely, because we're always promoting it, right? But we also want to make it as feasible as possible for people to do it. And so now we have it at least once a week where people can come in and do those stretches and exercises to keep the spine healthy here in the office with Erica.
Perfect. Anything else?
I think that's all for today.
Okay, perfect. So hopefully that helped you a little bit understand again does the name of your pain really matter? and understanding that, you know, we want to still get to the cause of what's causing it in the first place, and then obviously help you feel better. So hopefully that helped you today. So enjoy the rest of your day and have a wonderful, healthy commute.